A 64-year-old man presents to his primary care physician for the routine physical. He is in good health, smokes half pack of a cigarette daily, and has no other non-medical problems. However, he was diagnosed with hypertension in the past. The physician notes a blood pressure of 160 to 100 mmHg and a first-degree pitting edema to his knees. The physician also noted a bilateral bruise when auscultating the abdomen. Which of the following is contraindicated in the patient's care? Angioplasty, angiotensin converting enzyme inhibitor, diuretics, smoking cessation, or surgical management. So pause the video, select your answer. Till that, we will discuss the answer. So the patient here is demonstrating some sort of medical abnormality, that is, it is hypertension. The patient has hypertension and the patient has pitting edema and bilateral bruits on auscultating. So hypertension and the pitting edema, we can say that these are the problems which can show in different sort of problems related to the kidney, related to the heart. So in case of heart failure, in case of kidney failure, or in case of nephrotic syndrome, we can see a pitting edema on your leg, some sort of generalized edema in case of nephrotic syndrome. But here another point, it is the bilateral bruits. So bilateral bruits is common for the patients which having renal artery stenosis. If there is a vasoconstriction or there is a stenosis of the renal arteries, so we can say that due to high pressure in those stenosed artery, we can hear the bruits, okay, on auscultating the abdomen, on auscultating near the renal artery. So in this case, there is a bilateral bruits. It means that the patient has some sort of renal artery stenosis on both sides of the kidney. So there is a bilateral stenosis of the artery. So whenever there will be bilateral stenosis of the artery, there will be less blood flow to that of the kidney. So there is a less blood flow to the efferent arteriole. There will be less blood flow to the glomerular apparatus. So whenever there will be less blood flow to the kidney through the efferent arteriole, there will be low GFR. When there will be low GFR, there will direct mechanism, feedback positive mechanism of the juxtaglomerular cell, which then releases the renin, which activate the renin angiotensin aldosterone angiotensin system. So whenever there will be activation of the renin aldosterone angiotensin aldosterone system, there will be vasoconstriction, there will be the production of the aldosterone in order to maintain the blood level, blood volume into the our circulatory system. So whenever the activation of the angiotensin 2, finally it act on the blood vessel of the efferent arteriole. Okay, whenever it act on the efferent arteriole, there will be vasoconstriction. So whenever there will be vasoconstriction of the efferent arteriole, okay, the pressure increases. We can say that is the backward pressure. It increases the pressure into the glomerular apparatus. When the pressure increases into the glomerular apparatus, there will be effective GFR. The GFR start to rise up. There will be increase in the GFR. So it is a positive feedback and it is a very beneficial for the patient suffering from the renal artery stenosis. So it is very good for the patient. So if, for example, in case of angiotensin converting enzyme inhibitor, the enzyme which is responsible for the conversion of angiotensin 1 into angiotensin 2 in the endothelial cell of the lungs, okay, lung capillaries, there is some enzyme known as angiotensin converting enzyme. Whenever this enzyme not work, there will be no conversion of angiotensin 1 to angiotensin 2. So there will be no effect, there will be no action on the smooth muscles, that is the efferent arteriole, and there will be no action, no effect on the efferent arteriole. There will be no constriction. When there will be no constriction, there will be no rise in pressure. So when there will be no rise in pressure, definitely the GFR will not affect. The GFR still present at the low level. Okay, so this is not benefit for the patient which is suffering from the renal artery stenosis. So our answer will directly go to the second option. So angioplasty is benefit for the patient and diuretics is also benefit for the patients. Smoking cessation is also benefit. Surgical management also benefit for the patient. But our answer is that is the angiotensin converting enzyme inhibitor. It is not benefit, it is contraindicated in a patient which already having some sort of renal abnormality. So our next question is about child, that a 12-month old boy is brought to the physician after his parents palpate an abdominal mass while bathing him. They deny any fever, chill, decrease in urine output, or the hematuria on physical examination. A large mass is palpated in the midline. An abdominal ultrasound shows pelvic kidney fused at the lower pole. Which structure prevent this abnormal kidney from occupying its appropriate position? So if we study about the renal system, embryonic development and the embryonic ascent of the kidney, so we come to know that whenever the kidney form, the kidney present in the pelvic region in the fetus, okay, the pelvic region. So after the formation of the kidney start to move up to the lumbar region, thoracolumbar region, okay, T12 to L2. So this is the lumbar region, it moves up. This is known as the ascent of the kidney. That during the developmental process in the fetus, there will be ascent of the kidney start to move from the pelvic to the lumbar region. But in this condition, the kidney is still at the pelvic region. The kidney is at the pelvic kidneys, means the kidney is still present at the pelvic region. And the another abnormality is that the kidney is fused at the lower pole. So it is the fusion of the kidney during the embryological development. So the kidney, they fuse together at the lower pole. So this condition is called as horseshoe kidney. Horseshoe kidney, when the kidney during the developmental stage, they fuse together, okay, and they stuck to each other, and this condition is called as horseshoe kidney. So here ask that which structure prevent this abnormal kidney move to its appropriate position. So whenever the kidney fuse, there is a chance that the kidney move up to the lumbar region. But what are the structures which prevent the kidney to move to the normal position? So if we look about the aorta, no aorta is present at the thorax level, okay, at T12. Then it divide at the level of lumbar region into two main iliac arteries. So celiac trunk, no celiac trunk, because the celiac trunk originate from the level of L1, so it must be present at this level. So of course the kidney is here, the kidney should move up. Inferior mesenteric artery, inferior vena cava, no, the inferior vena cava is also has no relation with the kidney structure. And the superior mesenteric artery, okay, the superior mesenteric artery is also originate for the level of L2. So we can see that we can say that the superior mesenteric artery cannot stop the ascent of the kidney, but the inferior mesenteric artery, yes, inferior mesenteric artery present at the level of L3. So it is somewhat at this level. So whenever the kidney try to move up, when the kidney reach at this level, okay, there is a fusion of the kidney. So this kidney is stopped by this level. It cannot move to its original or the normal position in the adult. So during the fetal development, and when the kidney fuse before ascent, the kidney cannot move up by the inferior mesenteric artery, because inferior mesenteric artery stop the way of the ascent of the kidney. So our answer should be the inferior mesenteric artery. Thank you.